Stress city entrepreneur discovered, and don't cheat.
I noticed something strange about the way my heart was acting in certain circumstances, so I went to the doctors and they suggested I have an ECG.
I've just seen Mr. Denham. He's a 30-year-old gentleman who was sent up by his GP because his GP did a routine heart tracing, which he was slightly worried about, and he felt that there may be some underlying heart disease.
I didn't have to wait more than 5 minutes to be seen, and I'm straight here. I've had all the equipment put on me, and which, you know, what's going on.
And on seeing this gentleman, he's incredibly anxious, so it's quite difficult to assess because when you're anxious, your heart rate goes up and your blood pressure goes up.
Chris and girlfriend Tracy may run an internet company called Chill, but they're the first to admit they're workaholics who are anything but chilled. Although Dr. Nigel Giam is happy with Chris's ECG test, he decides to send him for blood tests and x-rays.
Hold your breath, hold it. Well done, breathe.
I've always had a fast heart rate, always, but I've always been a nervous type anyway, so it probably all adds up.
Half of the course really that he was stressed out, but then obviously this morning when he gets told to go straight down to accident emergency, it's kind of scary.
I'm actually more worried that they've seen me straight away, but obviously if they're seeing me straight away, something's wrong, you know.
We keep saying we'll do that once we've made the money, we'll take time out, you know, hopefully we can retire young. But when stuff like this happens, I think it does make you realise the big picture.
As Chris and Tracy wait for the results, it gives them time to reflect on their stressful lives.
But we both...
Chill.net, yeah.
Yeah, look at him.
This is a great advert for Chill.
Of Chill.net, you end up with an
Experts in irony.
That is quite ironic.
Essentially all the blood tests were fine. The only thing that we found was that you've got quite a high cholesterol, okay, which is the only risk factor we've got. The other thing that we found on your chest x-ray was that your heart was just on the upper limits of normal in terms of size. And so what we're going to do is just get a scan, which is called an echo. We'll see you in a couple of weeks after that.
Brilliant. I appreciate that. Thank you very much.
Okay, great.
But it would be nice if next time we go on holiday, Chris doesn't take his laptop with him. Worked every day from Tunisia whilst I sunbathed. You won't be doing that again. A holiday's a holiday. Work away. Next holiday, sunbathing.
We do see a greater proportion of young patients who present with chest pain in London. I mean, I think stress is quite a big factor in a majority of these cases.
I put myself under these extreme pressures because I want to succeed, I want to do this, I want to do well. And at the end of the day, your health is more important, isn't it? And I'm going to have to rethink the whole thing.
I'm glad things worked out for Chris.